Okay, evening, SJ here. I am just going to film myself having magnetotherapy live. Now I'm doing this for my hip. Now normally I would set this off for patients, so I'm going to get into this and press the button. Talk you through what is happening while I'm on this. This should hopefully go in. So normally we would set this off for our patients, so I'm just doing that now. Okay. So as you can see, the big donut. Oh, let me just check again. On. Sorry, everybody. I thought I had this all set. So I'm doing my treatment of magnetotherapy. I'll just go into the channel. And I'm going to be doing full body, even though I'm particularly targeting my hip when I am doing this. I am going to target my full body with this. That is me. How's it going? Okay, so I'm lying down, and this whole program just lasts for 30 minutes. So I'll talk you through me going through this treatment in real time. So you can see I'm lying on a bed, and there's almost this MRI magnetic, it's like a big donut, I suppose, I'm in the centre of going round me. And what's happening here is I am primarily using this for me. I had a joint hip replacement. I had my left hip replaced last August, so August 2021. And obviously I'm still young. I am currently only 44, so getting a hip replacement at the age of 44, pretty devastating, but a bit of bad luck, a bit of bad genetics, some crazy sports, a lot of running, and there we have it. I needed a hip replaced at 43. So hips and new joints don't last forever, and I'm very aware of that, but it's the biggest reason that joints or new joints fail isn't generally the joint itself. It is usually our tissue, our bones, our tissue around that joint, essentially rejecting that joint. Essentially, we've got metal in there, and where we've got this metal, the body, it just doesn't like it, and it doesn't produce, it doesn't regenerate the bone around that joint in the same way that it would our natural structures. So what happens over time is that it's not like we wear the joint out or the new replacement, it's more that our bone around the new prosthetic, everything starts to loosen off. So the joint itself becomes loose, and that is where most corrective revision surgeries are. Now, that's not the only thing that can happen. We can end up with infections, and there's a few other, dislocation. As we get older, our bone density, especially for women, so osteoporosis, fractures around the bone, can all contribute to the new joint failing. So these are all things that I am very aware of, given my job, and I am doing everything within my power to make sure that I get the longevity of this joint replacement and that I keep inflammation at bay, because I know that my body, with that metal being inside my body, the inflammation levels around that will be higher. And with inflammation, we get pain, and we don't want that. So what I'm doing with this is magnetotherapy. So as I lie here, I don't feel anything. It's quite a comfortable treatment. And what this is doing, the setting that I'm using this for is the osteoarticular setting. And my primary goal here with this is to help build my bone density and reduce inflammation. So to help build bone, not only just around this joint, because I am working my full body, and I'll go through in a moment why I'm choosing to do that and not just focus on the hip. So I have got my hip replaced, and I know that that is a worry. It's a worry certainly given I am currently 44, and I know at some point I am going to have some sort of revision. My surgeon told me that I should get about 25 years out of this new joint, but I know that that's a best case scenario, but that will also mean that in my 60s, if I'm lucky enough to reach my 60s, that I am going to be faced with a corrective surgery. And that, does give me a little bit of fear. I'm not going to lie. Having gone through this surgery, it's not to be taken lightly, but definitely was the best thing for myself with the pain that I was in. So I want to, going through that experience of that arthritic pain, that unless you have felt it, it's really debilitating and life-changing in a negative way. It really, really is. And I will never forget how much that affected not just my physical health, but my mental health as well, and how vulnerable you feel. And I never want to really be in that position again. So this is part of my looking after my bones. Now, I mentioned I'm 44, so I know that I will be, if not there already, I will be going for perimenopause. And we've got children trying to get in the door. And yes, Sophie. Right, Emmy will take you. Tell this is live. Children trying desperately to get in the door. So I know that I will be going through, certainly it's going to happen, menopause, but I'm probably already at that kind of perimenopause, and I've already started to just notice a few wee niggles, like I was waking up in the morning and my hands were just feeling a little bit stiff. That's been happening the last 6 months, I would say. So there's other little things that I know that as a woman that I am going to be, my bone density particularly, especially as I go through menopause, is going to drastically drop. So that's one other reason. Also, the inflammation in my body with the hip and the changes in myself with menopause as well. So what I'm doing here is I am treating my whole body, and I'm particularly working, as I said, on reducing inflammation and building my bone density. So it's, yes, for my hip, but also for general well-being and for that kind of perimenopausal stage. So what does this actually do? So it's magnetotherapy, and it's pulsed magnetic energy that is going through me right now. And that energy penetrates right through all my soft tissue. So if I've got any problems with any ligaments, any inflammation around muscles, it's also targeting this just now, even though my primary reason for being on this really is my bones and inflammation. But as a byproduct, I'm getting that as well. So if I've got any niggles in soft tissue, any muscle soreness, this is also going to be assisting and helping with that. It tends to also help with general well-being and that feeling of well-being as well. So what's happening is we're getting this magnetic energy, this pulsed energy, and it's not a new technology. It's just not something that is readily available in the UK. It's just not something that we have really picked up on. If you go to Europe, especially Italy and Spain, and also the United States, this would be something that wouldn't be alien to you. You would have heard of this. You would have saw this. You may have had a relative that you've seen maybe wearing magnetic bangles, possibly for pain. Maybe they've got some sort of arthritis, and it's the same concept. We're using that magnetic pulse energy to change cellular action. So what happens is, as I'm lying here, this is affecting my cells, and it's basically causing a calcium influx into my cells. And with that calcium influx, many things happen. So if I've got muscle spasms, it allows a relaxatory effect. It allows the protein, those building blocks of their tissue or life, I get an influx of that. I also get extra collagen production. Now, I hear all the women of a certain age all loving the sounds of collagen production. And yes, I suppose, yes, I am building my collagen, but I'm primarily thinking about around my bones and my joints, my ligaments, my tendons, all of that good stuff there. So it's at cellular level. That's what's happening down there. And a really nice way of thinking about this is I am almost charging up my cells. I am revving them up. So I'm literally, when I come off this, the way that I would describe how I feel is charged. That really is it. I just feel as though I've been charged up. It's a kind of funny feeling. I can sometimes feel a little bit lightheaded when I've been on it, not all the time, but sometimes. And just a general kind of state of well-being, I suppose, is what I feel. One symptom that I've noticed reducing this will be my seventh session, actually, seventh time on this. And after the fifth dose of this, I have noticed that when I wake up in the morning, my hands aren't sore. And that may seem quite minor. And it wasn't my primary reason for going on to this. My main reason really is my hip joint. But I know that as a byproduct of being on this, treating my full body, there's so many other mechanisms happening around from my feet right up to my head. And as a result of that, it's definitely changing. It's reducing that kind of inflammatory, perimenopausal joint stiffness and pain that I've been getting in my hands for sure. So for the last week, I've not had any pain in my hands. Now, in terms of what you do, if you're like, how do you get started? Like, where would you, like, do you just phone us? Do you just come in for how many sessions do you need? Well, regardless of what you're using this for, it isn't a one-hit wonder. You're not going to come on to this once and miraculously be cured of your arthritis or just feel amazing. It doesn't work that way. It's cumulative. So you need a course of 10 sessions very close together. So I am trying right now to get, if I can get in daily, I try, but the bare minimum that you'd be able to do is 2 per week to have a desired clinical effect. Any less than 2 per week, it's not going to do what you want it to do, so it's pointless. So the initial treatment dose is 10 sessions very close together. And at the moment, because we're introducing this and it's new, we are doing a little promotion where that block of 10 is £300. So we're doing a block of 10 sessions on this for £300. And with that, you can come in and get your dose, and you will get an effect from that. Now, after your 10 sessions, it totally depends what your circumstances are. Now, usually this would be combined with other things. So, for example, if we just go back to my hip, I am rehabbing my hip. I am making sure I'm doing everything. You know, I'm not just lying in this bed and thinking that's enough. I know I have to strengthen, I have to mobilize, I'm doing other things. So if that's you, that would be part of your treatment. So generally what we say to people is come in, book an initial appointment, and from there, if you are interested and we think that magnetotherapy would be suitable for you, then the option is there. And as I said, there's that promotion there, 10 sessions is £300. After that, individual sessions are £45 on magnetotherapy. And in here, we have nicknamed this machine Bob. So this is Bob. So if, for example, you are coming in, so for me with my hip, I will do my 10 sessions and then I'm going to just see how I feel. I may do a monthly maintenance of one session. It just depends. It might be every 6 weeks. It might be every 2 months. At this point, I will see how my body reacts to this. So if I start to feel my joints starting to hurt again, I know I need to come on and visit Bob Magneto. We call him Bob Magneto. So I will get myself on. So at the moment, I am doing my 10 sessions and I will review it after that effect and see how long my results last. But what I wouldn't need to do is another course of 10. I would just do little top-ups as and when I need it. Now, another indication of using magnetotherapy, which really is one of the main reasons we wanted to bring this machine to Glasgow, is for our patients with bone density issues. Now, that is every woman who is perimenopausal and going through menopause and postmenopause. That is you. So bone density, not just osteoporosis, but that reduction in bone density. If you are working on building your bone density, the indicators, so the clinical guidelines are 10 sessions twice per year. So you would come on to this machine for 10 sessions for a block of that every 6 months, and that overall, by continuing to do that, you are building up and growing your bone density. So that would be an example of a treatment protocol for bone density, osteoporosis, these sorts of conditions. Now, if you've got things like non-healing fractures, shin splints, things where there's bone issues, growth plate problems, then this really is where the magnetotherapy comes into its own. The bone, we apart from exercising to build bone density, we don't really have a lot at our disposal, and this is again why I wanted to bring this to our patients here at the Rehab Hub in Glasgow. It's really been something that I knew that was needed for our client base. Our client base does tend to be patients who are 35 plus, generally older than that, but we've got a good range. But our patients are usually maybe prehab, they've maybe had joint replacements, they're maybe trying to avoid joint replacements, or they're needing help after joint replacements. A lot of osteoarthritis here. Again, rheumatoid arthritis, all of your inflammatory arthropathies, your systemic conditions, ankylosing spondylitis, these sorts of conditions, that inflammatory process, this is where magnetotherapy really does come into its own. Obviously, in combination with other modalities and medical interventions. So you would still be taking, if you've got, for example, rheumatoid arthritis, you're still going to be, if you're on DMARDs, you're still going to be taking your medication and your DMARDs. This would be in addition to, it's not instead of, so I hope that's clear. And that goes with any treatment modality that we'd be doing with you here at the Rehab Hub, or what any healthcare professional would be working with you. It's not, there is no one size fits all with any any treatment, so whether it's shockwave, laser therapy, rehab, or anything, manual therapy, it doesn't matter what it is, there is no magical wand. We would use these as tools to allow us to best help you based on your requirements. So when you're in, essentially you're on Bob, as I am here. It's pretty comfy. It's I think this material here is quite soft. You're fine to, it does come over my head because I've got it on the full body setting. But if you were feeling claustrophobic with that, we could set it so it doesn't go above, here. So this would be level 5, and I want to have it coming up. I want to work my neck, my shoulders, all of this. I have no problem with that. We've not had anybody so far say that they felt claustrophobic on it, and it's fairly easy to just sit up. If you wanted to get up, it's not moving quickly. You could easily get up, and there's always a clinician close by. You can just give a wee shout if you're really feeling vulnerable or you want up. It's not a problem. You can touch this. It's not going to harm you. I can. It's not. It's not like you can't touch it. And generally, when I'm on it, I like to have my hands just kind of crossed over and just relax to the side. Other people just kind of sit their hands under their bum and just kind of sit on them just to hold them still like this. And you might fit me if you're a wee bit larger framed, or you're big busted. There's plenty of room there, but it's not an issue if you're touching the magnetic donut, we'll call it. So it's fine to touch. You're not going to damage yourself or anything, as long as you're not restricting it and stopping it moving. You're absolutely fine. It's comfortable. We usually have, you can see I've got a cushion. I think you can see that from your angle under my legs. I usually recommend that everybody has that. And the reason being is that you're lying here for 30 minutes. So you're joining me for a full session here. So because you're lying here for 30 minutes, if you're lying with your legs out straight, it can just hurt your lower back. I personally couldn't lie here for 30 minutes with my legs out straight. It would just kill me. So I appreciate being comfortable is important. The bed is shaped, which is great. So some of you might be fine just without the pillows and supports, but they're there for your comfort. You can see I'm fully clothed. There's no requirement to get undressed using magnetotherapy. It will go through the tissue. The magnetic field is right around me, so this whole donut. And I might actually, I think the little, I'll get it in a second. This goes back down. There's a little magnet, and I can show you once this passes. I should be able to sit up and get it. Oh, I must have dropped it already. But there's a little, in one of my other videos, I'll show you the kind of magnet. So when I'm lying on this, I don't feel anything, nothing at all. Honestly, most patients just fall asleep. It's quite comfortable, the room's quite comfy. I've got the big light on just now, just for the purpose of this video. But normally when you're in here, we just have a little corner lamp on. It's quite chilled. It's nice mood lighting generally, and you just relax. Now you cannot wear watches, no electrical devices. My laptop actually that you're on here is far enough away from this. But I couldn't be on here with like lots of jewellery and things on. You want to be free of anything that is conducting, essentially. So no watches, no mobile phones. So to be honest with you, even just lying here without any mobile phone or something for half an hour will do you the world of good. Our patients have been reporting, which is quite interesting, is that they're sleeping better. So that's been a good result for a lot of our patients. So we've literally only had this, not even 2 weeks now. So we're still early days with bringing it in, There's no other clinic in Glasgow. I don't know anywhere else, even in Scotland, that offers this. And I think there's maybe one or two that I know of in the United Kingdom that have got this. We opted at the Rehab Hub to get this machine rather than the spot magnetotherapy. And what I mean is that you'll not be able to see it on the video, but this machine, at the side of it, there's little pads that can go on and do spot areas. So for example, if I had a patient where maybe they had some degeneration of their spine, quite a lot of people have that kind of sacroiliac joint wear and tear, we could put the pads straight on to just treating their back. But what I felt was that most of our patients were coming in and they've got multiple things going on. It's not just their back or their neck or their knees, or there's usually a few things going on. So I knew that the best would be to have something that had that option where they could come in and have that full body approach should they wish. Now, I can choose, there's 5 areas in this when we're treating you. So for example, we had, Donna wouldn't mind me saying, so I'm not saying anything that Donna wouldn't be happy with me saying. So Donna was in sometime this week. She's been in a few times. And she has damaged the plantar fascia in her foot. She's basically torn it quite badly. So it's really sore. And so what we did with her was, she's got a couple of things going on. She's got had quite a lot of surgery in her knees. We've done some injections for her knees. So her knees are actually feeling great, but she's now got this plantar fascia problem. So what we wanted to do was really, really target the feet, but also target the knees and the other joints for Dora. So what we did was we didn't put the setting on the bottom down at her feet. We wrapped the magnetic and individual one right round her foot, so it was 100% on that, and then used the donut for the rest of her body, so that she was getting a high dose of magnetotherapy, all directed at her foot. And then we also could treat the rest of the body at the same time as well. So we felt like that was better to do that for her, for that the pathology that she's got in her foot, which right now really is, I think she's about 5 days post tear, so still very early days with that. But so we really wanted to target as much as we could onto the foot, but also get into the rest of the body and specifically the knee as well. So we can do those sorts of things, setting it wherever we want it. You could literally lie here and we could just have it on your knees if that's what you wanted. So you don't need to have it in your full body. But as I said, most of our patients have other things going on. The full treatment is usually between 20 minutes and 30 minutes. Primarily it is 30 minutes though, so you would need to make sure if you were doing a course of magnetotherapy that you had, you allowed yourself time to come in and do this. We are open 6 days a week, and the bookings for the magnetotherapy are open usually from kind of 9:30 in the morning up until about 9 o'clock at night most days. So there's a lot of availability there for using. And what I will say is though that we have been, getting this last wee while, we have been getting some select clients where we know this would work, and we've been giving them some taster sessions to allow them to experience what it feels like on the magnetotherapy machine, as we call Bob. So normally when I'm on this, I usually just doze off. I usually just fall asleep. You can hear it's not very noisy. We've usually we've got little Dyson just out of camera shot. Just keeps the room to a nice temperature. We usually have it, 20, 22 degrees for you, so it's nice and cozy. If you are a particular cold person, we can have the room at a temperature you want. But we also have, you can put a blanket over you if you wanted to. The great thing is that it will penetrate through your clothes, so you don't need to get stripped. The only thing you have to do is make sure no electrical appliances and basically no jewellery. Get all the earrings and chains and things off. So that is it. It's relaxing, it's non-invasive. Side effects, there's very few, none. There's no side effects in terms of apart from, I suppose, a few times that I've got off this, I've just felt a wee bit, it's hard to explain, a bit just like, that way when you just have your first glass of wine and you just feel you've got a bit of a buzz. That is probably how I would describe it. You've just got a wee bit of a buzz about you. Just feel a bit, I don't know, that's how I would describe it, that wee buzz that you get. So that's probably the best description I have. But you might not get that. That's certainly how I feel. Not every time I come off it. The first time I went on it, I didn't really feel anything. And then it was, I think the second or the third time I just thought, and I was doing them daily for the first couple. And I did notice that's kind of when I noticed a little buzz feeling, I feel like I'm a bit merry, a bit charged. So I'll enjoy this. I'll get a good night's sleep tonight with this. It is lovely. And that's it. That's half an hour done. So the machine, when you're on, just beeps like that. You can see the big donut just takes itself down. At this point, you would just get up. That's it. So you would just set yourself up, slide yourself out. And that's as complex as it is. Whew. Feel good, and I feel I'm going to be honest, I feel a little bit dizzy, so I'm going to sit down. I'm just feeling a little lightheaded, so I'll let myself just recover from that before I start walking about. So it's, in terms of, not everybody feels like that when they get off. I don't know whether it's just me that I generally do kind of get a little, I always need a wee moment. And a few patients report the same, but not everybody does. So we'll figure, that's me feeling fine now. So a little bit kind of, just buzzing. And I just wouldn't have liked to have just got up there and started moving about. I just felt a little bit, funky head. So I hope that's been interesting to just see that real time. I'll grab the magnet, it's fallen down there. I don't know what I've been doing. Sorry, I'm in this wee room, and I'm here with the kids tonight. Probably I would have heard Sophie trying to get in the room, but I break in, telling me she needs the toilet. Her big sister took her, in case you think I've just left her. So here I've got a little magnet, and usually what we'll do with patients, because see when you're lying on this, you really don't feel anything. If I put this up so you can see my face a wee bit better, you don't feel anything. So this is just a little normal magnet, and so it's just on my hand. I'll try and do it so you can see it. So I'll turn this on. So I'm just going to go into channel, is fine. Go in and do. Put it up to, we stay at 5 actually. So what I'm doing here is just setting where this donut sits, so it'll actually stay up here. And it's going to start. So this is just a magnet, and what I'm just demonstrating here is basically the magnetic current going through. So you'll start to see the magnet. These will just bounce. Oh, goodness. Right, so you see it here? It's going a bit crazy. So it's staying here because I've just set it to stay up here. So this is me giving you a demonstration of, you know, how I can just set it in one place. So you can probably see that jiggling about under here. I'll bring the camera in closer. You can see, essentially, you can see how it's starting to lift up. So as I come out, just normal magnet. And as I go under, you'll see it starting to lift up. See it just comes off. So you don't feel that, you don't feel anything. I'll find that later, it's way down there. You don't feel anything when, I'll turn this off so I'm not overly dosing myself. You don't feel anything really when you're on, where that magnet's going now. Literally, so it's good to get that little demonstration when you're on it because you think, what's this doing? It's not doing anything. You literally feel nothing. You just feel like you're lying on a bed and there's a big thing going around you. Yeah, don't be fooled. It is quite powerful. Right now, after being on that, dizzy for, I don't know, a minute there. What was that? I stayed there for. I felt a wee bit lightheaded when I immediately come off. And then right now I feel, it's a weird sensation. It's like, you know that way when you have like maybe a glass of wine, you just feel a wee bit jittery or a wee bit lifted. That's generally how I feel after it. Then it just settles, but it's literally like being charged, and it definitely is cumulative. So when you're doing it more often, so I'm going to do my 10 doses. So that's my 7th. I've got another 3 to do, and then I'll leave it, and I'll leave it for at least a month before I go back on. But I'll see how I am. So my kind of telltale sign definitely has been my hands. My hands, just old age, it sucks. But definitely that kind of perimenopausal. I'm clearly, I'm 44. I'm going to be, it's going to happen, and I think definitely it's already. And I just was finding my hands, and it was summer, so it wasn't even the cold. So sometimes you can get kind of cold, sore, stiff joints in the winter. It's just been over the last few months. I've just felt, I've woke up in the morning and I've been like, oh, my hands are really sore. Like it's almost like I've had to do this a few times before, like warm them up, which is a classic sign of inflammation and arthritic changes, joy. So that's immediately what I noticed. I think it was about the 5th session that I just noticed that I woke up in the morning and I was like, oh, and I was like, my hands aren't sore. And this is the only thing that I've added, only thing that I've changed. So, which is great. And you read the research around it and you look at all the indications and what it's doing. It clearly is working. But it's just, that way sometimes our patients in here love getting shockwave, and they love shockwave because they feel it. They can feel something. In laser therapy, they don't feel anything. And generally our patients go, well, I don't really like the laser as much. But even though the mechanism of action is, very, very effective, they tend to not like it as much as shockwave because they're not feeling it. It's not this mechanical thing that they can feel because they can't feel what's happening in their cells. And this is a bit like that, where you're just like, I don't feel something hitting me or touching me. But as you can see with the demonstration of the magnet, there's clearly stuff going on. And honestly, like, I feel the difference. And I spoke to a patient that was in last night, and I was like, how are you feeling afterwards? She was like, oh, I was just feeling a bit buzzed. I was like, interesting. I was like, that's probably a good way. It's like charged. So this is magnetotherapy. I'll get off now. I'll go and find that magnet that I've managed to lose again. And if you're interested, what I would say to you is that, remember, this isn't just a treatment that you just come on and we would just fling you on it. It would be part of something that you need. So whether you've got, maybe you're like, actually, I just quite like to build my bone density. Your first protocol would be book an initial consultation, because we want to make sure that it's indicated, it's right. I don't want to waste your money and waste your time. So we'd always check that it is right and that you're able to do it. In terms of who would not be able to do this, if you have a pacemaker, absolutely you cannot go on this. And if you're pregnant, absolutely you can't go on. So those are the only two absolute contraindications. The rest of it, pretty much, it's safe to do. So first protocol, book an appointment, whether that's with one of our physios or whether that's podiatry. It really doesn't matter. What's your problem? If it's anything from the waist down, that's your podiatrist, and anything above the waist would be physiotherapy. So, or I mean, to be honest, book any. Our clinicians in here are fabulous. They'll be able to help you no matter what it is, and they put you towards the right clinician. Should be, or book myself if you prefer that. But essentially, that's what you do: initial consultation, and then from there, this would usually be used in conjunction with lot. Currently, of our patients that are maybe doing Pilates as well have been in and are using this. We've got a couple just now using it for lower back pain, tons with osteoarthritis. We get lots of knees in here, a lot of knee replacements, knee problems. People try to delay or put off or just avoid knee replacements, tons of them. Obviously hip replacements as well, but I would say more so in here, knees. Is definitely where we seem to be getting a lot of patients. There's I think our name is getting passed around a lot of places for the place to go for arthritic knees. So those kind of things we absolutely can help. Right, I'm going to go and get these children home, find this magnet, and yeah, go and have a good night's sleep. Have a fabulous, what night are we on? That's Thursday night. And I will see you really soon. Thanks for listening.